I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. So I personally feel that every patient should know how the medicines work for their condition. And especially when it comes to type 2 diabetes, once you understand how the medications work, it's easier to take control of the diabetes. In this video, I'm going to discuss about how diabetic medicines work. I'm not going to talk about insulin treatment in this video, and I'll make a separate video in the future. Okay, so without further ado, let's get started. So before I talk about diabetes medicines, let's first understand type 2 diabetes. So type 2 diabetes is due to two things. So one, there is insulin resistance. The other most important thing is that the pancreas is unable to meet the demands of the insulin resistance. So let's say when you have insulin resistance, you need more insulin. But let's say the pancreas is not able to produce that more insulin, then eventually the blood sugar goes up. So let's understand how one develops insulin resistance, or what is insulin resistance. So let us say you eat too many refined carbohydrates like bread or sugar. Our insulin secretes from pancreas to keep the blood sugar down. So some of the glucose gets used up by the exercising muscles. The rest of the glucose gets stored in the muscle and liver, and the excess glucose after that, they get converted into fat. So we all have fat stores in our body. So there are fat stores that are present outside the organ that is called as the subcutaneous fat, and the fat stores that surround the organ, which is called as the visceral fat. So we just don't understand why one develops insulin resistance and one doesn't. The prevailing theory is that we all have different levels, different amount of fat stores in our body. So for example, let us say we have one person has like 5 bags of fat stores on the subcutaneous fat. The other person might have only 3 bags of subcutaneous fat. So once they fill that 3 bags of subcutaneous fat, the rest of the fat just goes around the organs. And our body doesn't like that, which is why our body starts developing insulin resistance. So basically our body says that, you know what, we cannot just keep putting the fat around the organs, so we need to stop this from happening. And this leads to insulin resistance, thereby causing the pancreas to secrete more insulin to overcome the insulin resistance, and thereby this diabetes develops eventually because the pancreas is not able to keep up the demands of the insulin resistance. So basically, in summary, when it comes to the management of type 2 diabetes, it is important to decrease the insulin resistance as well as important to decrease the blood glucose simultaneously. So now first let's talk about pills that increase the insulin secretion. So in this category, there are two classes of drugs, sulfonylurea and meglitinide. So how I no longer prescribe meglitinides? So commonly used sulfonylurea medications include glyburide, glipizide, and glimepiride. Examples of meglitinides are repaglinide and naticlinide. So these medicines are designed to stimulate pancreatic beta cells, encouraging them to produce more insulin. It is important to note that in patients with long-standing diabetes and poor sugar control, there is a possibility that these medications may not be effective. This might be due to the fact that the beta cells of pancreas are not responding at all. So the biggest side effect of this medication is basically hyperglycemia, basically low blood sugar, since the medications act by increasing insulin secretion. So depending on whether you take a quick release or an extra release tablet, the medication can last anywhere between 12 to 24 hours. So if you're using these medications, please exercise caution while exercising, as this may increase your risk of experiencing low blood sugar levels during prolonged physical activity. If you notice symptoms of frequent low blood sugar, it is important to have a conversation with your doctor. Now let's talk about the pills that decrease the liver production of glucose. So the drug class in this category is called as bicronide, and the metformin is a commonly prescribed medication in this category. So before we discuss about metformin, let's understand the role of liver in diabetes. So both the liver and muscle, they serve as storehouses for glucose. In times of starvation or intense exercise, the liver releases glucose into the bloodstream to provide energy for the working muscles. However, under normal circumstances, the liver does not release glucose as it follows the directions given by insulin. Basically, the insulin makes sure the liver does not release glucose in the bloodstream. So basically, the insulin acts as a commanding force in regulating glucose secretion from the liver. So basically, the other way to say this is that the liver actually is very sensitive to insulin's commands and behaves properly. But let us say when the liver is resistant to insulin, then the liver does not behave properly, and then it starts to pour glucose into the bloodstream. So basically the drug metformin helps to correct the liver behavior by increasing its responsiveness to insulin commands. Essentially, metformin enhances the insulin sensitivity, thereby resulting in the liver adhering to the insulin's commands and stopping the production of unnecessary glucose into the bloodstream. So metformin is very highly beneficial for patients that experience elevated fasting blood sugar levels. So the most common side effect is gastrointestinal, Basically, this includes abdominal pain, diarrhea, metallic taste, nausea, and vomiting. So to avoid the gastrointestinal symptoms or the abdominal symptoms, it's important to make sure that you start slowly and gradually titrate up the medication. It's important to avoid consuming excess alcohol when you take metformin. In addition, metformin can also cause B12 deficiency. So metformin decreases the absorption of B12, and let us say if you're taking another medication like pantoprazole or omeprazole, this increases the risk far more. Okay, so let us say if you start to develop fatigue or if you start to develop any nerve pain, make sure that you also consider B12 neuropathy rather than just diabetic neuropathy alone. Now let us talk about pills that improve the sensitivity of the insulin. So the drug class is called as thiazolidone, and the commonly used drug in this class is called as a pioglitazone. So basically this medication is almost like a mimic of exercise, where it improves insulin sensitivity in the muscle and fat cells, and thereby the glucose can be absorbed into the cells more effectively. Even though I said exercise mimic, I still use this medication very cautiously because of its side effects. So the retention of fluid caused by this medication can worsen heart failure and can place additional strain on individuals with pre-existing cardiovascular conditions. Now let us talk about pills that slow down the breakdown of carbohydrates. So basically the drugs in this class are called as the alpha-glucosidase inhibitors, and the commonly prescribed medications in this class is actually called as the acarbose. So they suppress the enzyme responsible for breaking down carbohydrates, resulting in reduced absorption of glucose. As a result, it effectively decreases blood sugar spikes. Unfortunately, this drug is poorly tolerated because the unabsorbed carbohydrates can cause side effects such as abdominal pain, diarrhea, and flatulence. They can also cause low blood sugar when combined with insulin or pills that increase insulin. Now let us talk about pills that helps pancreas. So the drug class that we're discussing is known as DPP-4 inhibitors, and it comprises medications such as sitagliptin, linagliptin, and saxagliptin. These pills function by suppressing an enzyme responsible for breaking down GLP-1, thereby indirectly boosting the levels of GLP-1. So the question is, what do we gain from increasing the GLP-1 hormone? So basically, what is GLP-1 hormone? Within the lining of a stomach and intestine, there are specialized cells. So these cells respond to the stretch of a stomach or intestine, and they also respond to the presence of carbohydrates by releasing a hormone known as the GLP-1. So the GLP-1 signals the pancreas to increase its production of insulin, acknowledging that we have consumed food. So what the insulin does is that it lowers your blood sugar. Furthermore, the GLP-1, it also interacts with the neighboring cells responsible for producing glucagon, and it decreases the glucagon release. So usually glucagon actually increases blood sugar, but the GLP-1 decreases glucagon and increases insulin, and thereby it leads to a decrease in blood sugar levels. But here's where it gets interesting. So the GLP-1, it slows down the emptying of the stomach, and thereby it provides a sense of fullness and decreases the appetite, which helps to regulate food intake. So basically DPP-4 inhibitors, they increase the GLP-1 hormones indirectly. But the problem is that this medication can be expensive, and the A1C reduction, basically the blood sugar control, is only modest. However, there's an option to directly inject GLP-1, and that's called as GLP-1 injectables. And I've actually made a separate video on this topic, and I'm going to attach the video at the end of this video. Now let's talk about pills that actually make a person urinate sugar. There used to be a time when diabetes was diagnosed based on 3 symptoms: polyuria, which is basically increased urination; polydipsia, which is basically increased thirst; and polyphagia, which is basically increased hunger. Fortunately, we don't see these symptoms more often nowadays in type 2 diabetes because of early screening. So let us understand, why does a person experience increased urination due to diabetes? So basically, the excess sugar in the bloodstream leaks into the urine. This usually occurs when the sugar level exceeds 180 mg per deciliter. This excessive sugar in the urine attracts water and consequently leads to increased urination. So even though the excess sugar in the urine causes increased urination, but still some of the sugar would be absorbed back to the body and thereby causing worsening of the blood sugar control. So now we have a medication available that addresses this issue by obstructing a transporter known as the sodium glucose transporter, thereby enhancing the excretion of sugar through urine. The drug class is called as the SGLT2 inhibitors, and the medicines in this class include canagliflozin, dapagliflozin, and empagliflozin. So the side effects are all due to the sugar elimination through urine. So let us say when there is too much sugar in the urine, it can increase the risk for infection, it can increase the risk for yeast infection. So since sugar actually brings more water, it can increase the risk for dehydration. So let us say if you're exercising in the heat, you should be careful with this medicine. Let us say if you're taking another blood pressure medication, then it can increase risk for low blood pressure. Since you excrete sugar in the urine, the body starts to use more ketones for energy, let us say there is too many ketones in the bloodstream, then the blood can become more acidic, and we call that as ketoacidosis, which can be a serious complication. Other uncommon side effects include acute pancreatitis, increased risk for bladder cancer, fractures, and risk of amputation. I hope you now understand how diabetes medicines work. Okay, we talked about benefits and side effects of these medicines. So please do not let this video deter you from taking the diabetic medications properly because of the side effects. Remember, uncontrolled diabetes is far more dangerous than the side effects of the diabetes medicines. So some people might come and say that, okay, since these medicines all have a lot of side effects, I'm going to take supplements. The problem is that one, the supplements may not be as efficacious as the drugs are. And the other thing is that the supplements can also cause side effects too. So let us say if you decide to take supplements for diabetes, please make sure that you monitor closely by your doctor to see if the supplements are working for your diabetes or not. But remember this, by adopting a healthy lifestyle and engaging in regular exercise, individuals can effectively manage diabetes. Through consistent effort, patients can work with the doctor to minimize the reliance on medication. The primary objective of diabetes management is to maintain stable blood sugar levels while minimizing the need for medication. If you found this video helpful, I'm going to ask you a small favor. Can you please hit the like button so that this video can reach more people? If you want to know how non-insulin diabetes injections work, basically the GLP-1 injectables work, then make sure that you check out this video here. If you're suffering from A1C more than 9, then this video can be really helpful. Okay, and I'll see you in my next video. Until then, goodbye.